everyone, my name is Lydia Felt and I am going to present to you Epidermolysis bullosa. Epidermolysis bullosa is also called the worst disease you've never heard. People who have this disease, their skin is as fragile as a butterfly wing, so they also have the nickname the butterfly children. Their skin is so fragile that any contact with clothes, heat, Band-Aids, any friction whatsoever, their body forms blisters and they start to tear. This disease can also affect the lining of the mouth and intestines, so some people have problems swallowing and eating. The body does not produce the protein that anchors the epidermis and the dermis, which are the two layers of the skin. So they are essentially falling apart from each other. And the pain is described as severe as a 3rd-degree burn. There are 5 different types of EB, and they all affect the different genes, and they all have different outcomes. The first form of EB we are going to discuss is simplex. Simplex EB is an autosomal dominant disorder. It is the most common type of the Epidermolysis bullosa. It affects mainly the soles of the feet and the palms, and children first notice this when they're starting to become more active, playing outside, more hands-on. This is caused by the gene that produces keratin for the epidermis, and it is faulty. So as a result, you have blistering. The most severe form of EB is junctional. It is an autosomal recessive disease that both parents need to have the gene in order to pass to their children. This is the most lethal due to the high risk of infection because the fibrils that attach the epidermis to the dermis are faulty. And this also affects the vocal cords, causes blistering and scarring, so it causes difficulty in breathing for those who have this form of EB. Dystrophic EB could either be dominant or recessive. You can have several different severities of this case, from mild to severe. And the collagen fiber is faulty, so the layers of the skin do not join properly. Kindler is an autosomal recessive form of EB, and blisters start to appear on all layers of the skin. However, with time, these blisters do tend to disappear, and they improve with time. Due to the blisters, those who have this form of EB are noticed to have mottling of the skin if they are exposed to sun. This form of EB is the easiest to live with and has the least risks associated with it. Acquisita is not inherited, so you cannot get it from either of your parents. However, it is an autoimmune disease that attacks the healthy tissues that make up your skin by mistake. So the fibers and the proteins that hold together the epidermis and the dermis and the muscles, those are being attacked. This causes blisters of the hands, feet, and mucous membranes. Not all forms of EB have the same signs and symptoms, but they are usually at risk for infection and sepsis due to the removal of the skin barrier and the access to the blood vessels and the body loss. You have anemia, syndactyly, which is the fusion of fingers and toes, renal insufficiencies, dysphagia, and you can have choking associated with that if it starts to attack your esophagus, malnutrition, scarring, alopecia. your scalp can blister and you can have hair loss. Skin cancer is a risk. Constipation, osteoporosis, contractures because they're not able to move their extremities properly. Pyloric atresia, which is the obstruction of the lower part of the stomach and prevents food from emptying out of the stomach into the intestines. They can have dental problems from poorly formed enamel. They can have eye disorders, like inflammation of the eye. Since most forms are genetic inheritance, genetic counseling takes a big role into informing the parents of the risk. Prenatal testing, you can do an amniocentesis, which is taking a sample of the amniotic fluid to test for any genetic mutations. And also for those who actually have the disease, skin biopsies to confirm. There is no cure to EB, but education on daily wound care and bandaging is crucial to prevent infections. Pain management is also important, and also meeting up with a dietitian to discuss good food plans. And mostly they suggest soft foods to prevent irritation of the esophagus and the intestines. Thank you so much for watching, and I hope that you have a better understanding of epidermolysis bullosa now.